Out of the way. Good. All right. So in the month of October, we across Ghana, mental health professionals, we are celebrating mental health awareness creation all over the country. And as part of it, we decided to also host one of the specialists to talk to us on mental health and to focus on one of the major mental health disorders, one of the major mental health disorders as well. So, once again, welcome all of you to the Weekend Health Talk. I am Albert Sedo here. As always, I'm pleased to have in our company today a specialist psychiatrist, um, a woman who understands what mental health is and what mental health disorders are and how to manage it and how to be of great help to anyone who seeks help. Today, please join me welcome Dr. Josephine Styles Darko from the Kolebu Teaching Department, Kolebu Teaching Hospital Psychiatry Department to share with us on the topic depression. Dr. Josephine, over to you.
Okay, thank you very much. And good afternoon to all those that have been able to join us so far. So this afternoon, we are here to talk about mental health, and we are focusing on depression. Okay, so just before we zoom into depression, we'll look at briefly mental health. Why the noise about mental health? So mental health is indispensable and it's part of our overall health. I mean, there's no health without mental health. And when we say mental health, we are talking about a state of well-being where an individual is able to cope with all the stresses of life, is able to achieve all they want to, and is able to contribute meaningfully to their society. Okay. Our mental health affects the way we think, how we feel, and the way we behave. That is our actions. It determines also how we are able to handle stress and how we relate to others. That is our relationship with other persons. And mental health is important at every stage of life. Children can have mental disorders as well as older persons. So it is a very important thing to consider if we want to live a long and healthy life. Okay, so now zoning into depression. Why are we talking about depression today? Why should we bother? Depression is very common. I'm sure most of us on here have heard about it severally. It's one disorder that greatly affects the outcome of other physical illnesses. Okay, if someone has any other illness and they have depression, it affects how they are able to recover from that illness. Okay, and it also affects how the individual is able to function. And depression contributes to about 50% of suicides. So that again tells you how important this topic is. And then there is treatment. There is treatment. And once depression is diagnosed and managed, an individual is treated well, it can improve their overall functioning, can improve medical treatments and even surgical outcomes. So these are a few of the reasons why we are here today to talk about depression. So this chart we are seeing just talks about our mood or what we call our emotions. That's the way we feel. So normally we have a wide spectrum of emotions. We can feel happy, we can feel sad, fluctuating in between. And then there are times where you feel a little better than your usual happy self. That's when you have a very great day, for example. When you have a bad day, your mood dips a bit. These highs and lows are usually within a normal range, and this is normal for everybody. Now, depression. When most people hear depression, the first thing that comes to mind is sadness. But depression is more than sadness. With sadness, it falls within the normal range of emotions. Something happens that is not too pleasant, you react to it, you feel down a bit. But this usually does not persist. A sad person is able to do what they have to do. For sadness, I mean, you can usually just get over it and move on. It doesn't affect the way you function. But when it comes to depression, this is an illness of the brain. And with depression, we are talking about an illness that is affecting your thoughts, in turn affecting how you feel, and then how you behave. It is not something that someone can just snap out of. And it usually persists, usually more than 2 weeks. And eventually, anyone that is depressed will need to get help. So that basically is the difference between sadness. Depression is deeper, if you like. So what does depression look like? Yes, so we've said that it's a disorder of the mood. So it's a disorder of how you feel. So usually in depression, the predominant feeling is sadness. However, in some cases, people who have depression can be a bit irritable. That's getting angry too quickly or easily over minor things, okay? And this goes on most of the time, most days, for 2 weeks or more. Aside the mood, feeling low, just don't feel like doing what you usually love to do. Other symptoms include losing weight. On the flip side, some people may also eat a bit more when they are depressed and therefore gain weight. There's trouble concentrating, feelings of guilt. Sometimes even feelings of guilt for things that have absolutely nothing to do with the person. For example, somebody saying that they are responsible for the Russian-Ukraine war, something that has absolutely nothing to do with them. And unfortunately, sometimes in our parts of the world, if the person starts to say things like this and it has some meaning to us, then sometimes these persons may be termed as witches or having caused some damage to people when they may just be going through depression. Also, individuals who stay away from social interaction. So they don't want to talk to anybody. They just want to stay on their own. They avoid any form of social interaction. Or the person is just restless. For adolescents, it comes along with poor academic performance. They are not able to concentrate. They can't read and understand. For adults who are working, it does also affect the work performance, okay? Somebody who is depressed may take unnecessary risks, especially when they feel like they feel worthless or that life has no meaning anymore. And sometimes they may feel just indifferent about everything and pay less attention to themselves. So you know somebody that is particular about looking good for every occasion, and now it's like they just don't care. Their hair is unkempt, they don't care what they are wearing and all that. And then also comes in the self-injury, where somebody has thoughts of suicide or thoughts of harming themselves because of how they are feeling. Okay, so these are some of the symptoms or what depression looks like. So these symptoms are not isolated. Not that you meet somebody that is that just pays less attention to the appearance and it means they are depressed. No, these symptoms come together. So with depression as an illness, you have a couple of these symptoms coming together, persisting for a duration. Then there is the possibility that this person may be suffering depression and therefore needs help. So depression can come on in different phases. So we can have mild, we can have moderate, we can have severe. For all these forms of depression, help is needed in one form or the other. And usually we want depression to be picked up early so that we don't get to the severe form, which usually affects the functioning more. Okay. So these are some of the warning signs that we all need to look out for. I've mentioned most of these in the symptoms already. You realize that somebody is constantly feeling hopeless. All that they keep saying shows that they have no hope at all. They feel like they can't be helped. They feel their life has no meaning. They can't sleep or have sleep difficulties. They are not up and doing, somebody that's very sociable and all of a sudden they don't want to mingle. So things like that. Or an individual talking about suicide. Sometimes we think when somebody talks about suicide, they really don't mean it, but that is not true. People who talk about suicide may go ahead to attempt or actually succeed in committing suicide. So that's something that we don't need to joke with at all. So some of these warning signs, when we notice it, then we know that we need to take action. Okay, so who can suffer depression? So depression, like any other mental illness, can affect anyone. It doesn't respect your race, it doesn't respect your age, it doesn't respect your sex or your gender. It can affect a child, an older person, an adolescent, an elderly person, okay? And the symptoms are a bit different in each age group, but the message is that depression can affect everyone, even children. Sometimes we think that children don't have much to worry about, so they don't have the right to be depressed. But children can get depressed. Just that sometimes they present a bit more difficult and differently. You may have the child throwing tantrums. You may have the child constantly complaining of certain symptoms, for example, tummy aches or pain that is not, you can't really place a finger on and things like that. So when that happens, when you have these constant things coming, you know that you need to see a health professional and see if there's something going on with this child. Okay. So what causes depression? There's still a lot of research ongoing, but some things have been picked up and have been associated with depression. These factors can include the biological, which is with the person themselves, their genes, their makeup as an individual, also the psychological aspect as well, and then things that happen around us, that is within our environment. So some of these factors include events that happen in our lives that are very stressful. And of note are when these events occur, especially in the early ages, okay? So when something really awful happens to somebody, they have that risk of developing depression in the future. Sorry. Sometimes for children, when parents are overprotective or harsh, it may put them at risk as well. When the home environment is not conducive, there's conflict between yourself and your partner, the children, and the whole home is chaotic. That is also something that can cause depression. Sorry. Also, when there's violence, for example, in war conditions, and then when the socioeconomic situation is low, like what we are facing in Ghana now, okay? Also, when people are ill, they have chronic illnesses like cancers, liver conditions, and all that. it can also put them at risk of developing depression. Pregnancy is not an illness, but it can also predispose somebody to getting depression. Okay. Pressure from left, right, center to conform to the norm of the day, using certain substances, drugs, alcohol, and the like, can also make somebody susceptible to depression. And sometimes now social media is very, very out there. We are on right now, and there are certain things portrayed on social media which we perceive as the norm. So when we see ourselves, sometimes certain individuals see themselves falling short of these expectations on social media, then they begin to worry more, and this may predispose them to getting depression. So if we don't treat depression, then what? So depression has effects. It has consequences if it is not dealt with properly. And these consequences may be to the individual themselves and also to the society at large. So the individual themselves going through these series of thoughts that they are of no value, wishing that they are dead, that they are alone and all that, having thoughts of suicide and all that, may eventually go ahead and commit this suicide, ending their own life. Also, if they have illnesses, like I mentioned earlier, it would hinder their recovery, so making their symptoms worse and all that. To the society, such an individual will be unproductive. If you have an employee who has depression, they are not going to be able to achieve much, and that is going to cost the society. A person who probably could have great ideas, could contribute meaningfully, may be hindered from doing so by depression. So it affects all of us, not just the individual, their family, their friends, and the entire society at large. Okay, so we need to take note of that. And when we know somebody with depression, encourage them to seek help, because help is available, really. So how do we avoid depression? Just like any other illness, any other mental illness, we need to take good care of ourselves. Our brain is part of our body. Whatever we feed the body would use it and give it back to us. So we need to eat healthy. We need to sleep enough. Sometimes because of the pressures, we are trying to meet our economic targets and all that, we steal some of our sleep time for productive time, okay? And that can cost us. We need to exercise regularly. Try to have fun. When you struggle, make your money, spend some. Take a break, have fun. Do something that makes you happy. Take time off to relax. Even in the midst of a tight schedule, take a few minutes to relax. The world won't end if you do. And it will go a long way to help you to be more productive, okay? It helps to have supportive people around you. Let's support each other, our family, our friends, and then get help. Whenever you are in crisis, get help, okay? When you see somebody in crisis, help them, support them to seek help. And these are a few of the things that can help us to avoid mental illness or get the help we need early enough to prevent having more severe mental illnesses. Okay, so for those of us here today, how can we help? If we see somebody who is going through any of these things we've mentioned, we have to be understanding, we have to support. We have to listen to them. Sometimes all they want to do is talk. We have to listen to them. If they want to cry, we have to allow them. We shouldn't judge them. We should let them know that they are not alone. Spend some time with them, show genuine concern. If they want to talk, if they talk about harming themselves, don't just take it as if they are just saying things, okay? They may really go ahead to do that. Or you see somebody giving out their things or start saying things like, oh, if I'm no more, give this to this person, or they start making their will or sharing their assets, then you know that, hey, that's a warning sign. They may be thinking of ending their lives, okay? But then there's a limit to your support. When they need professional help, they need professional help. And at that point, all you need to do is to support them, point them in the right direction to get professional help. So I've said that depression can be treated. This treatment starts with seeking help, okay? And our role is to support the individual in seeking help. When an individual comes to us as professionals, there are a number of things that we can do, including psychotherapy, which is talk therapy, and also medications, among other things that we do, depending on the severity and the symptoms that the person is presenting with. Okay. So I think we've looked at this already. So just to conclude, what are we taking home? We are taking home that depression is common, but it is treatable, okay? Most people feel better just a few weeks after they start the treatment, and it accounts for a good number of suicides. So we have to be very vigilant and then seek help on time. Only a few people will come up on their own to seek help. So we have to support each other and help each other to seek help. Okay, so the world we are in right now, there are a lot of challenges, and we need each other to bring joy, to bring hope, to remind us that there's hope, and to help us and point us in the right direction. Okay, so mental health is very valuable. It is the new wealth. So in ending, I'll say that let us all take time out to prioritize our mental health. Thank you very much for listening.
Thank you very much, Dr. Josephine. Please, let's give her some few seconds to take some sip of water. She's been giving the health talks all week. So please pardon her. She's been giving health talk all week. Today we had a Kolibu floats all around Kolibu environment, and she's been giving health talk on TV, on radio all week. So she has actually been overusing her voice. So thank you very much, Dr. Josephine, for such an in-depth presentation. Please take some sip of water, because some people have some questions to give you. So if you have any question at this point, if you have any question, please put it in the chat box, put it in the comment section. Dr. Josephine will answer every question for you. What is most important, I like the quote that if you see somebody without a smile, give the person one of yours. If you see somebody without a smile, give the person one of yours. And very important, the message you want to put out there is mental health is the new wealth. Mental health is the new wealth. Now, mental health, anybody hears mental, there is that stigma around it. So we are trying to let people understand what mental health is. Dr. Joseph made it clear, a state of well-being when people are happy, enjoying life, relating well with others, and contributing positively to the society. Now, mental illness is a condition that affects the way you think, you behave, and the way you feel. So there's a difference. What we want to promote is mental health, and the statement that says that if you see somebody without a smile, give the person one of yours. There is help available. If you need help, just seek it. Dr. Joseph put up a slide with a suicide hotline. If you can go back to that slide, that has a suicide hotline. A lot of people don't know who to call. Yes, it's a toll-free line. You're in that situation, or you know somebody who's in that situation, you call, help is available. If you have any question, please, at this juncture, feel free, put in the chat box, put in the chat box. We've talked about mental health, what it is, mental illness, what it is, and we've delved into depression. It's quite common. It affects your productivity. It affects every other thing, even recovery from surgery and physical illnesses. So we all need to. And I like the part where Dr. Josephine said, if you make the money, chop some. I like that part. If you make the money, chop some. Take time off and rest. It's very important. Most of us are just chasing after the money. The point is, the truth is, if you chase money, you won't get money. You have to attract the money. So if you make the money, chop some, have some rest. You know, it's very, very important for your mental health. Okay. Now, the first question will be coming from me to you, Dr. Joseph. If somebody has depression, does it mean the person will be on medication for life? That's the first question I want to give you.
Okay. So having depression doesn't mean that you'll be on medication for life. Depression is one of the mental illnesses where we treat you, you get better. Okay, after a while, you're taking off the medication. But I must add that having depression at one time does not mean that you can't have depression ever again. There are times where people have depression, they get treated, everything is okay, they get off their medication. But sometime later, depending on certain factors around them, they may develop depression again. As I said, it has to do with the biological, the psychological, more of your thoughts surrounding what is happening around you, and then even the environmental. So when somebody goes through any unpleasant event, any loss, it can trigger depression, irrespective of whether they've had it before or not. But the treatment is definitely not lifelong.
All right, thank you very much. My second question to you is, does it run in families? If your mother has depression or is being managed for depression, is it possible you can also have it? If anybody else has any questions, put it in a chat box, put it in the comment section. Dr. Josephine will help us. We have a few more minutes to handle all that. Okay, so
depression does have some heritability. Okay, it's a little below 40%. What that means is that, yes, if you have a relation that has a mental illness, not even just depression, but any other mental illness, there is the possibility that you yourself may develop a mental illness. But this possibility is not 100%. That means it is not punctual that once your mother or your auntie or your father has suffered depression, you would also have it. Always remember that it is not just about what you have inherited, but it is also about what is happening around you and how you are coping with the stresses as well.
Very important point to note. It's not just about what is happening to you, but what you are inheriting. It's not just about what you are inheriting. That's the biological aspect. What is happening around you is also very important, which means that you can have the genetic aspect, but you may never manifest. Is that true?
Yes, exactly.
Good. All right. So does it mean that once somebody in the family has it, you're going to have it? We have a very important question from a YouTube audience. Somebody's asking, Stella Nate is asking, can a person be treated without medication? She's talking about prayers. Can prayers help with depression?
Okay. So with depression, well, not even just depression, with any kind of illness, okay, there is room for our faith. There is room for what we believe in, okay? And when people have, you see, what faith does for us is that it gives us hope. And hope is one thing that mental health also seeks to do. So there is some comfort in spirituality and prayers, but then the individual also needs help, needs professional help, needs treatment. As I said, depending on the severity, usually for cases of mild depression, depending on what is going on, an individual can be managed without medication. okay? But then when it is more severe, we need to put you on medication, and the prayers can still continue. It is very, very supportive, and it really helps in giving hope to the individual. So why not?
All right. So yes, there's place for faith. But again, if the person has depression, seeking professional help will do you a lot good. And there is help available for anyone who seeks it. There is help available. Dr. Joseph made it clear the difference between sadness and depression. Depression is a disease of the brain and it persists. Very important, a catchy statement she made was, you cannot just snap out of depression. That is very important for us all to know. You cannot just snap out of depression. For sadness, if the cause of the sadness is taken care of, you may be able to snap out of it. But for depression, you cannot just snap out of it. And if you find somebody who is in that state, seek help for the person, be supportive, show love, and care. It's not by witches or witchcraft or anything. You need help. Dr. Josephine has explained. If you have any more questions, please put in the chat box in the comment section. Dr. Josephine will be glad to answer the questions. Any question at all concerning depression, any confusion you might have, where to seek help, or whatever question, whatever queries you might have, please, we have a few seconds more to go. Feel free to put it in a chat box so that Dr. Josephine can. It was a great presentation. I enjoyed myself. We learned a lot, and I hope you also learned a lot as well. Anybody else has any question, any queries you want to? Our YouTube family is growing. Lots more people are joining us live on YouTube. Thank you very much for joining us live. The recording of this presentation will be posted on the YouTube link. So if you have not subscribed yet, you can freely do that. I'm just posting the link in the chat box for the Zoom family. Can movies and sports help somebody who is depressed?
Okay, so movies, sports, these are hobbies. These are things that when you're interested in and you do, it helps you to relax. It helps you to feel happy and feel good about yourself. But the thing about depression is that if somebody is depressed, it takes a lot to get that person out of that low mood. Remember, I said that it is different from sadness. If somebody is sad, let's even say, for example, somebody has lost a parent or somebody is bereaved. Sometimes they can actually watch a movie, they can engage in a sport, and at that moment, they will be happy, they will laugh and all that. Okay, but depression is a bit more than that. It's a bit more than that. Sometimes people are good at hiding their emotions and they may appear as if they are moving along, enjoying the movie and all that, but deep down, they may be going through a lot more than just ordinary sadness. So yes, they can help, as in doing it on an everyday basis to keep your own mental health good for you. But when somebody is depressed, mild depression, yes, being around, supporting them, pushing them to do a few activities may help them to come out. But when it's getting worse, that may not be enough.
All right. Thank you very much. Any more questions? Okay. Somebody is asking if you can give her the signs of depression. She had network challenges. I will advise you just go back and watch the recording so that you get a full picture. All right. Now, a question is, does the state of the economy influence depression?
So when I was talking about the risk factors or the factors that may contribute, I mentioned the socio-economic status. Okay, so well, the economy goes a long way to affect us as individually, and it affects us differently. There are people who may have way less than somebody, and they may be very happy and bubbly and all that. But definitely, if your economic status is dropping or declining, I don't think you'll be a very happy person. And it doesn't mean that definitely you're going to get depression. But what that means is that you may be at risk, or it adds on to the factors that can predispose you to getting depressed. Yes.
Yes, so yes, the economy can have an effect. It can predispose you and push you to manifest your depressive symptoms faster if you already have the predisposition. Yes. Somebody wants to know, does depression has anything to do with blood pressure?
Okay. So depression doesn't, more I would say is that depression is not really a cause of blood pressure. But I mentioned earlier that when somebody has a physical illness, for example, the blood pressure or hypertension, which we are talking about, high blood pressure, and the person is depressed, for example, the person may not feel like doing anything, even including taking their medications for the high blood pressure. And with that, definitely their blood pressure is going to go up, and they may even have complications of that, okay? And the depression in itself, depending on what the person is going through, the person may not be sleeping too well, the person may not be eating too well, and all other things which may affect their health in general and may worsen the high blood pressure that they may be already suffering. So yes, it can affect it.
Great. So, all right, somebody's asking, can a person with depression be hyper?
Okay, I'm assuming the hyper here means the person is over the top, happy, I mean, all over the place. So usually people who are depressed may not be hyper in the sense of being hyper all over the place, bubbly, over the moon and all that. But people who are depressed are not always gloomy and hidden in one corner. There are some cases where somebody that is depressed may be a bit restless, may be a bit agitated, a bit irritable, getting angry easily, snapping at people here and there, but they may be depressed. Yes. So I wouldn't say hyper in the sense of being hyper, because once they become hyper, they have tipped into another aspect, what we call mania. But people with depression can be a bit active, irritable, agitated here and there, which also adds on to their symptoms.
All right. Thank you very much. If anybody has any other question, please feel free to put in the chat box so that Dr. Josephine help us. Madam Joyce, Dr. Josephine took us through all the signs that you might be having depression from the beginning. So I will kindly advise that when the recording is shared, you go back and watch it and have the full presentation to have the full understanding to know what signs shows a person could possibly be suffering from depression. The recording will be shared on the YouTube channel, Madam Joyce. Barina, yes, Madam Joyce, the recording will be shared. So she went through all of it. So when the recording is shared, you will have full access to it. All right. Does anybody else have any other question? Anybody has any other question to ask Dr. Josephine before she takes leave of us? Like I told you, the whole week she's been giving a lot of health talks on TV, radio, and in persons, and she's actually been overusing her voice, but she still agreed to show up to share with us on depression, mental health, and then depression as well. Thank you very much. Can one's inactive sexual life cause depression? Let me go over the question again, Dr. Josephine. Can one's inactive sexual life cause depression?
Okay, I'm not too sure I understand what the person is saying by inactive sexual life. But obviously, if you're having challenges with your sexual life, especially when it comes to the issue of performance. For example, if a male is having challenges with erections or erectile dysfunction or any other disorder related to their ability to have sexual intercourse. Yes, that can be a big stressor, and that can predispose a person into to having depression. Okay, but then again, if probably you could come back and explain what you mean by inactive sexual life, maybe it may help me to answer your question better. But definitely, if somebody is having,
this is coming from a lady. Maybe what she's trying to say is she's not been having sex for a long time. Can that predispose her to having depression?
Oh, okay, all right. So, well, it really depends on what you are thinking of, but in general, if somebody is not active, sexually active, that doesn't predispose them to having depression, unless it is something that they are really bothered about, or it is because of there is a particular reason why they are sexually inactive, not because they have chosen to be. Okay, then probably that could trigger depression. For example, if a lady is sexually inactive because they are waiting for marriage and they keep going back and forth and are unable to stay in have a good relationship and all that, that may cause them to think about this and start having certain thoughts that may predispose them to depression. But just generally being sexually inactive doesn't predispose you to depression.
All right. Thank you very much. If there's any more question, please put it. We have just 60 seconds more so that we can allow Dr. Josephine to have some good rest. She's done great. The presentation was very elaborate. Every detail is in there. The good thing is the recording will be made available a few minutes just after the call. So you can go back, watch it, share with your friends so that we all get educated and seek help for who may need it, including ourselves. Mental health impacts greatly on our productivity in every aspect of our life. We all need to be aware of it. Thank you very much. So in the absence of any other questions, I just want to say thank you very much, Dr. Josephine, for availing yourself to teach us, to share with us on all this. And most importantly, I enjoy some of the slides. If you meet somebody without a smile, give the person one of yours. Yes, if you meet somebody without a smile, give the person one of yours. Thank you very much, everyone on the call. Please, if you enjoyed and you got some value from the presentation today, put value in the comment and in the chat section. If you got some value on the presentation today, put value in the chat box and in the comment section. So I know that you were blessed. You may not have had a question. All your questions might have already been answered throughout the presentation. So I want to be sure you got some value from this presentation. I enjoyed the presentation. I learned a lot. Yes. Yes. Bright Atiasi, yes, the recording will be shared. It will be on this on the YouTube channel. I've shared a YouTube channel in the chat box. So you can just subscribe to the YouTube channel and you will receive the notification. I will share it on the WhatsApp pages as well. If you don't have it, just go to the YouTube channel. You have every access. All right, Bright Atiasi. Thank you very much. So those who joined us late, it is available. It will be left on the YouTube channel for you to have your own education and share with friends as well. So everybody on the call is saying they had great value from the presentation. Dr. Josephine Styles Darkun, we appreciate you. Thank you very much for your time.
Thank you for having me.
All right. Now, for our audience, this is the weekly program that I host, aiming at reducing misinformation on topical medical issues. Weekly, Saturdays, 4:30 p.m. I always host a specialist in the different fields of medicine. We've had a lot of sessions with a lot of other specialists so far. If you have not subscribed yet to the channel, you have not benefited from the previous recordings, feel free to visit the YouTube channel and they are there for your perusal as well. Feel free to share so we help more people get accurate medical knowledge. This is free specialist consultation online. All right. So thank you once again, everyone who made time to join us, sharing with your friends and family as well. Until we meet again next week, it's been me, and once again, it's been a plum pleasing pleasure serving you all. Enjoy your evenings.